Welcome back here to New Day Cleveland. September is Ovarian Cancer Awareness Month, and today is Teal Talk Day, hence the teal here. And teal is the color that represents ovarian cancer awareness, a cause near and dear to my heart with the loss of my mom. Well, today I am joined by the man who gave my mother the precious gift of time after her late-stage diagnosis, her gynecological oncologist, Dr. Robert DiBernardo, joining us from the Cleveland Clinic this morning. It's so good to see you. Always a pleasure seeing you.
Great to see you, Natalie. How are you?
I'm doing well. This is always a bittersweet month, but it's so important to discuss this issue. And I think one of the scariest things, Dr. DiBernardo, is the fact that 90%, when you listen to the statistic, 90% of women don't even know the signs and the symptoms of ovarian cancer. Even though they're subtle, they don't know what they are.
That's so true, and it's important. And this is one of the things that I have to commend you. We need to get the message out because most women don't know the symptoms and are not aware, and so too are many of their doctors are not familiar with the symptoms because they are subtle: bloating, nausea, vomiting, changes in people's bowel habits, things that are subtle and happen to all of us over the period of time. And those early signs are easy to ignore, especially as we talked the other day in the area of COVID, when people are a little bit more afraid to go out to the doctor or leave their house. So, the one thing that would make those symptoms stand out and make you really question is when they're persistent for longer than a few days or a few weeks, right? I mean, if, oh, we had something that was just, oh, I had something bad to eat, it should pass in a few days. Or it was a virus, it should go away in a couple of days. But if these are persistent symptoms, you should seek, help and see a medical professional.
And I think one of the reasons why, and to no fault to anybody, one of the reasons why we don't put as much emphasis on this is because it is rare. There's about 22,000 women diagnosed with this every year. But my mom never would have thought she would be one of those 22,000. So that is why we still do have to place such an emphasis on this.
We do. And the thing is that in addition to, paying attention to our bodies and not ignoring symptoms, I think the fact that it is a rare cancer, if you have symptoms, it doesn't mean you have ovary cancer clearly, but getting checked out does make some sense. And the other thing, as you know, seeking out proper care for this cancer makes a big difference.
Yes.
As you said, I'm touched the gift of life. It is does make a difference if you see people that deal with this cancer often. We know outcomes are better and people can live longer and better, have access to clinical trials and therapies and things that otherwise they would not necessarily have. So
Again, the signs are subtle, and it's not normally caught until sometimes later stages. But I think what is important too for people to remember is that it can still potentially be caught sooner. And during the stage that we're in right now with COVID and with the pandemic going on, you touched on this, and I want to expand on this. It's changed the way we do things. Your life has changed the way you're worried about maybe going to the doctor's office because of getting COVID. But so how has it changed in your field with chemo, with the day-to-day of people just coming in? You want them to come in, I'm sure, to get checked
of
out if they
course.
think there's something wrong.
So, I have to say the hospital is probably one of the safest places to be. We really have done an awful lot very early, identifying COVID patients and giving them an area in the hospital that's safe so that everybody else is not exposed. Every patient essentially in our institution, we know their COVID status because if they're coming in for an operation or whatever, we're testing them. So people should feel safe going to the doctor. Everybody's masked and everybody's taking precautions. And so while we do a lot virtually now, which makes sense, I think the message should be clear. It is safe to go to the doctor and it is safe to have mammograms and your other screening tests because cancer's not going to stop. Cancer doesn't care that there's a pandemic. And as you said, most women with ovary cancer, unfortunately, are diagnosed late in their stage of their disease because the signs are subtle. And I think delaying getting evaluated is certainly not going to help. So that would be my message: is let's not let COVID, make our cancer outcomes worse. Let's get to the doctor when we need to. Let's keep up with our screening tests.
Agreed. And I know that funding locally goes a long way. And I know congratulations are in order because you were recently endowed a chair. I'd love for you to speak about
Yes.
that.
Well, the Fogarty family was so kind and generous. These cancers are, as you know, Natalie, not on the national radar screen. So funding for ovary cancer and funding for uterine cancers are not a national priority. And so through generous gifts like that, we're able to do research here at the clinic and in other institutions across the country to really make a difference in women's lives and answer those questions about these rare cancers that are not otherwise being addressed. So thank you.
Congratulations. I'm so happy to hear that. I'm going to leave you with any final words you might have about this. I know, as a woman and having seen my mother go through this, I would say trust your gut. You know your body. Listen to it. If you feel something's wrong, seek help from a doctor.
Absolutely. And the other thing is, in the era of COVID, I think this is now our new normal. And I think figuring out a way to get screened and having your medical issues dealt with, I think is important. And like I said, there's a lot of stuff going on virtually, which is wonderful. But as you and I have always said, trust your gut, trust your body, and women have to be their own best advocates. And so I would encourage and empower women to seek that out and not take no for an answer.
Again, Dr. Robert DiBernardo, he's the section head there at the Cleveland Clinic for Gynecologic Oncology. I always call him our family's angel because you gave my mother that gift of time that we might not have had with her, and I will always be grateful to you. And I thank you for being with us today, getting the word out there. It's such an important cause. I've also linked some information on my Instagram page. If you go to one of my highlight reels, all the symptoms, all the facts you need to know about ovarian cancer. I just want to help as much as I can. But again, Dr. DiBernardo, thank you so much.
Thank you, Natalie.
Always a pleasure.